for joining us so promptly. I want to make another quick announcement. We do have now a dinner reservation at 6 p.m. at Zaitinia, which is just next to the Gallery Place Chinatown metro stop. We'll only have the table between 6 and 8 p.m. because they'll have to kick us out, but I know that a lot of people have traveled very far and probably are not looking for a late night. So I just want to confirm the number, right, so that we can give them a precise count. Show of hands. 1, 2, so 3. Let's see. Oh, hang on. Oh, okay. So 3, 4, 6, 8, 10. So we're 10 by the looks of it. We can double check with them. Great. So very good. I think we'll obviously just convene, in the hallway and try to figure out how to move together in an efficient manner.
You can take metro, right?
Yeah, or just walk. We've been cooped up in a building all day. So, great. Well, welcome back, and we wanted to devote this session to some discussions about different tools and lessons learned and implications for the future of civil registration and vital statistics scale-up work. I think we have 2 very exciting presentations, one from Sonia Rastogi, who directs the CARA, the Center for Administrative Records Research. What does the A stand for?
And applications.
And applications. So it's CARA.
We use Kara.
And Karen Carter from the Secretariat of the Pacific. And we're very fortunate to have 2 excellent colleagues to moderate the discussion about emerging challenges and opportunities for new empirical and methodological research. Tom Herzog and Carla Abuzar. Sonia, you have the floor. Thanks.
Okay, great, thank you. My name is Sonia Rastogi Porter. I changed it last year, and I'm still having trouble recognizing that I've changed it. So I often actually call myself Sonia Rastogi, but not in front of my husband. So today I'm going to talk about population and housing administrative records, infrastructure, and research at the U.S. Census Bureau. And thanks for organizing this. This has been a great day so far, and I also look forward to tomorrow. Today, the key topics that I'm going to talk about are record linkage. I'm going to focus on population and housing data. That's the data that we work with in our center. I just want to mention that, or I guess specify that, because at the Bureau, we also use a lot of economic data, and actually our economic administrative data, the use of that is much further along than the population and housing because of as you would expect, a lot of the things that we've talked about today, record linkage issues or coverage issues with the population and housing data. And then I'll provide some research examples. I'll talk through one in depth, and then if I have time, I'll talk through a couple others, but I definitely, if I don't get through all of them, it'd be great for you to take a look at my slides to see some other examples. So in the Center for Administrative Records, which is CARA, we link decennial census data, administrative records, and external data and survey data together. Our record linkage system is called the Person Identification Validation System. And what it does is it assigns unique person identifiers and also address identifiers to administrative records, third-party data, and census data to facilitate unduplication and record linkage. The address identifiers are called Master Address File Identification Numbers, or MAF IDs, and the person identifiers are called Protected Identification Keys, or PICs. And I'm going to use the word PICs a lot throughout the rest of the presentation. And the way that we assign the person identifiers is that we use social security numbers. And in the United States context, everyone gets a social security number at birth now, except for people that have come into the country either illegally or if they come here on work permits and have ITINs. And this becomes important, as you will see in some of the coverage issues that I show, given that we rely on that social security number, or for people to be in a file that has social security numbers for our record linkage process. We also use name, date of birth, gender, and address when available. So here's some statistics on our record linkage. So again, the PIC is the unique identifier that we assign. And for federal files, we have a really high PIC rate. So we're able to assign PICs to 97 to about 100% of records on these files. And a lot of that is because we have social security number. And for a lot of the programs that we have data for, which I'll go through some of the data that we have, a lot of people need to be US citizens with social security numbers to actually access the programs that we're dealing with. But that's not the case for all of the files. Third-party data, which I'll give you some examples of in a few minutes, but third-party data really comes, as an example, would be from data aggregators. So people that are putting data together from property taxes or the white pages, or it could be putting like foreclosure information together, but we're external sources of data. And we have a more difficult time assigning PICs to these data, often because they have incomplete name information. Sometimes they have had the wrong social security numbers, like the digits have been sort of reversed. So the quality of the what we call personally identifiable information is not as good in the third-party data as what we find in federal files. And then we also put our unique record linkage identifiers on decennial census data and American Community Survey data, or surveys. And we don't collect social security number on our surveys. So here we're really using name and date of birth, and we're still able to get pretty high PIC rates, so 91% or 94%. For the decennial census, or 94 for the 2013 American Community Survey. But we do see bias on who we're not able to put these record linkage keys on. So young children, we have a more difficult time putting PICs on. Minorities, people that are in group quarters. With group quarters, sometimes those come from administrative records data themselves, or an observer might be actually someone that it's not a household member that's actually writing down the information. So that's why we likely get lower PIC rates, because the information is incomplete. Immigrants, recent movers, low-income individuals, and people that are not employed, we also have more difficulty putting PICs on. This slide shows examples of data that we have in our center. I'll give you some examples. So for the Center for Medicare and Medicaid Services, we get Medicare data, which is a health insurance program for people that are 65 years and older in the United States. And then we also get Medicaid data, which is data for low-income individuals. We get data on Indian Health Service from Health and Human Services, or temporary assistance for needy families. We have housing data, so people that receive rental insurance or housing insurance. We get tax data from the Internal Revenue Service. From the Social Security Administration, we get this file that we call the NUMIDIN, or that's called the NUMIDIN, and that's the file that we really use as the backbone for our record linkage system. It's the file that has all the Social Security number information and also transactions in it, and that's what we're able to enhance that file with some of these other administrative records files in order to look up people to assign them the PIC. And then we also have U.S. Postal Service information, so national change of address data. So when people move in the United States, if they choose to tell the U.S. Postal Service that they moved, we have information about that move. And that's important because in probably a lot of people's contexts, mobility is a factor in terms of being able to deal with record linkage, but also for coverage issues in terms of a census or a survey. We also get program participation data, and these are the state administrative records. So supplemental nutrition assistance program data is a food stamps, it used to be called a food stamps program, but it helps with providing food for people, and temporary assistance for needy families, women, infants, and children, and low-income home energy assistance program data. These are examples of the third-party data that we have. Again, a lot of these are from data aggregators, or for instance, have foreclosure information. The reason that we have a lot of these files and that we acquire these files is that we're really interested in the contact information, and we're interested in finding people at addresses for our decennial census program. And contact information, meaning telephone numbers or email addresses, so that if people don't respond to our surveys or they don't respond to the census, that we're able to reach back out to them and try to get a response. We also put unique identifiers on our decennial census data, so Census 2000 and the 2010 census. We're trying to go back to other censuses and put record linkage keys on them, but we don't always have name or date of birth, so it's definitely more complicated, but we're looking into other record linkage techniques than the ones that we're using currently to be able to do that. The American Community Survey, Current Population Survey, and Survey of Income and Program Participation. So these are surveys that either the census does for the census or we do on behalf of other agencies. And then I'm going to now go into an example of using the matched record linkage keys to match administrative records to our decennial census. So it can give you a sense of coverage and also issues with record linkage when we're matching the data. James, who's sitting there, myself, and our center chief in Kara, did an evaluation to assess the accuracy and coverage of administrative records data compared to the 2010 census results. It's the first national level study of its kind that actually links administrative records to the decennial census. Previous research on this used to look at counts from, for example, Census 2000 and counts from administrative records to do comparisons, but this is the first one at a national level that actually used matching. And what we did is we matched a composite of administrative records data, which I'll show you on the next slide, to the decennial census to evaluate addresses, person address pairs, so persons at addresses, and then also demographic information that we have on our decennial census form, so race, ethnicity, sex, and age. I'm just going to focus on the person results because it at least gives you an example of some of the record linkage and also coverage issues. I'm not going to go into all of the data. This is some of the data that I mentioned on the other slide, but if you take a look at this over the next couple of days and if you have questions, definitely grab me or email me with more questions about the data. But definitely use the 2010 census data, and then these are the administrative records files that we used in the evaluation as well. So the blue bar in the next several slides indicates the 2010 census universe and the people with the protected identification keys or PICs. And so what we see in the blue bar is that we were able to put PICs on 90% of people in the 2010 census file. And that's about 300, so out of the 308 million people in the census, 90 got a PIC. About 10 million people did not get a PIC because we did not have any personally identifiable information to be able to assign a PIC. And 19 million people, we have some information on them, but we weren't able to assign a PIC, and we need to think about other record linkage techniques in order to assign PICs to those people. The red bar represents matching the decennial census data to the administrative records composite, which is all those files on the previous slide merged together. And so when we match these data, we still have a pretty high match rate at 88.6%. And one thing to note on all of these slides is that once we're able to put a protected identification key on either the administrative records data or the census, that the match rates remain very similar. And so why that's important to us is that 19 million people that I said that we don't have record linkage keys on right now, if we can find ways to put record linkage keys on them, we're hoping then that we will in fact find them in administrative records and that our PIC rates and our match rates will go up. On this slide, the next couple of slides sort of show differential coverage for different groups. And what we see here is that Hispanics have lower PIC rates compared to non-Hispanics, so about 80% versus 92%. And then they also have lower match rates at 77% to 90%. And some of this might be because of that issue that I mentioned before, is that the file that we're working with has people that have social security numbers or ITINs, if people are working here legally. But to the extent that some Hispanics, but this is the case for Asians as well, but that some Hispanics might be unauthorized in the United States, then we wouldn't be able to put record linkage keys on them because they would not be in the sort of backbone of our reference file to be able to assign the unique identifiers. But we're going to be doing more research to try to link, to do a better job with Hispanics. This slide shows the pick rates and also the match rates by race. And what we see here is that the white alone population has a very high pick rate, 92%, and has also a very high match rate at 91%. The group that has the lowest pick and match rate is what says SOR alone. It's the second to last set of columns or bars. That's the some other race alone category. And in the United States, the people that, about 97% of people that report in that category are Hispanic. And so what we were seeing on the previous slide, where we had sort of low pick rates for Hispanics, is being sort of also represented here. But note that Hispanics in the United States can be of any race, and so you do have probably 55% of Hispanics are actually in the white alone category, and about, I think it's in 30, I can't remember off the top of my head, but 30-some% are in the some other race alone population. Here are pick rates and match rates for age. And as you can see that for older age groups, so 45 to 75 or older, we have really high pick and match rates at about 93% and above for pick rates, and close to 93 and above also for the match rates. Where we have a little bit more difficulty is in the 18 to 24, but also for children. And what's going on with children 0 to 2 is that we have a high pick rate, but we have a low match rate. And part of that has to do with timing of files. So one file that we have, the tax data from the IRS, has pretty good coverage of children relative to other files. But the thing is that we get that file, the file that we're using is from a previous, people are reporting on a previous tax year. And for the decennial census, we're capturing where people lived on April 1st. And so from January to April 1st, those babies are not going to be reported in the previous tax year. And so part of that issue for 0 to 2-year-olds is that we have that lag with the IRS data. But we're looking into using other data like the Supplemental Nutrition Assistance Program data or Medicaid data, some of the data that would have children in it, the program participation data, to see if we can increase those match rates even without the IRS data, but also trying to think about other ways to use IRS data to get that number up. This is a map of match ratios for the 2010 Census and Administrative Records by persons, and purple represents a high match rate, and blue does as well, where yellow and orange represent a lower match rate. And so, as you see, there's a lot of geographic variation. So we saw that there's variation across groups, but you also see it geographically. And we do really well in the Midwest and parts of the Northeast, but we don't do as well in the South and also the West. Okay. How am I on time? I thought I set my timer.
You have 4 minutes.
4 minutes. Okay, great. I have just a couple other examples of how we're thinking about using administrative records data. Administrative records data can help us understand survey measurement. And so James did this work where he matched Medicaid administrative records data to the current population survey, and a group of academics and also other agencies worked together and did some work on the first 5 years, and James extended this out. But what we see is on the red line. This is the undercount of people reporting Medicaid in the CPS. So it's actually quite high. And there's two parts of measurement error that are contributing to that undercount. We have false negative error, which is the blue line, and we have false positive error, which is the green line. And what the false negative error is that people are saying in the CPS that they don't have Medicaid coverage, but in fact we do find them in the administrative records. And false positive error is that people say that they do have Medicaid coverage, but we do not find them in the administrative records. And this is just an important use of administrative records in terms of identifying errors, survey measurement error, and then potentially using these data to help with imputation or other or even help with questionnaire design to see what the issue is. Another way in which we're using administrative records is to help with program participation and eligibility. So survey data has a lot of great information on characteristics that you often don't get in administrative records. And you can also determine eligibility in survey data if you merge those data to administrative records data. So what we did with, and what we're doing actually around the country with different states, is we're merging SNAP data, which is a Supplemental Nutrition Assistance Program data, to the American Community Survey to see who is eligible for SNAP and who's participating. And this information, particularly by characteristics, can help program administrators think about how to target their programs better. So if, for instance, in a county, we see that elderly people are not really receiving these benefits, but they're eligible, then program administrators can help target elderly people in a particular county. And we're actually making data visualizations and putting them up on our website eventually, hopefully this year, so that people can actually click on counties and see different characteristics by race, by age, by ethnicity, by medical insurance, and make it a little bit more user-friendly than looking at tables. This is just another quick example of what you can do with administrative records for programs is that you can actually match programs together. So there's a program called the Earned Income Tax Credit, and we matched that program with the SNAP data to understand, again, who is not participating that could be targeted. And if you look over in the almost very last column at 7.3%, it means that these people are eligible for both programs, but they're not participating. And this could be helpful to program administrators. And we have also characteristic information, which would be helpful to program administrators. My last example is that, again, sort of a measurement example, in that race is something that is often is very important in the United States, but what we found is that there is some fluidity to it, and this is something that a lot of sociologists and demographers have talked about or found in qualitative studies or small studies, but we were able to document it linking both the 2000 census together with the 2010 census. And what we find is that stability is black, and joining a category is purple, and leaving a response category is the orange yellowish color. And so what we find is that whites, blacks, and Asians have very stable responses, but all the other groups have very unstable responses. And this has implications for how we think about different measures like inequality, or when you're trying to administer a program, are you seeing the same people if you're looking cross-sectionally and understanding the data, are you really seeing the same people as they move from one point in time to another? And so my last slide, first I want to thank you, but I also have my contact information. The middle link has a lot of our working papers, and it includes record linkage papers, so I encourage you to check it out. And then the last link is a record linkage link, sort of what we link and how we do it. It's still in development, but hopefully it will grow to be more useful in time. Thank you.
Great, thanks, Sonia. While Karen's setting up, Does anybody have a burning clarification question or quick, very, very quick comment? Okay, it doesn't look like it, so let's just move straight on to Karen Carter from the Secretariat of the Pacific, who's going to share a lot of lessons learned from the Pacific Islands. Thanks a lot, Karen. You have the floor.
There we are. You'd think I'd have learnt to have driven a microphone by now. I'm going to start out this afternoon just by acknowledging this is a very intimidating group. The collective expertise in this room is somewhat overwhelming, and that's fantastic to have it to have it all in one place. I'm going to do something a little bit different from the earlier speakers today. I'm not going to go through one particular paper. My background is I currently work for the Secretariat of the Pacific Community. So my job there is coordinating our regional support program around CRVS. And I've previously been at the University of Queensland, where I worked with Chalaparty and several others, where we did a number of record linkage studies. First of all, we did a 3-source study in Bohol in the Philippines. And then we've also done 2-source comparisons in Kiribati and in Tonga. So I'm going to draw particularly from those Pacific papers, the Kiribati and Tonga papers, along with some of our more recent experiences as we're starting to look at future studies that we're setting up in the region. We have a couple of processes underway. They're not funded yet, so they're not locked in, but we're starting to look at things like record linkage around prisoner mortality, road traffic accidents, and some of those more specific things which we know are a public health problem in the region. So I've been asked specifically to comment on some of the importance of record linkage for our region, and I think one of the nice things about the Pacific is we are small, but many of the lessons in the region can be applied at small scale and then scaled up to very similar issues elsewhere in the world. We have life expectancies that are well below what we would consider acceptable. Some of our member states have very reasonable life expectancies up in the 70s, but we have several countries which are still down in the 50s. And in this day and age, that's not good enough. There are significant data gaps. We've just published a couple of reports around life expectancy and infant mortality, and particularly on neonatal mortality, and the data gaps in there are phenomenal. Again, these are the countries that we want to know most about, and we talked about this morning. The countries where we have the greatest level of concern are the countries where we don't have routine data. And so we've got this idea that there's a problem, we've got anecdotal evidence to support that, but we don't have really solid data to back it up, and particularly to back up how it's changing, whether we're having an impact. Many of our CRVS systems are still developing, and they can't currently collect all of the births and deaths. We know our census methods are a problem. We have a really, really large non-communicable disease problem in the Pacific. We have people dying early in adulthood from diabetes, from cardiovascular disease. And our census methods are not adequately correcting for this. They're picking up, they're too driven by the children in the census. So what we're seeing is that we can't measure the impact on adult mortality as well as we would like. And we need our CRVS systems to be able to do that. And finally, surveys are expensive. We have a very rich, very in-depth survey program and census program in the region. But that program is essentially at capacity. Many would argue it's actually over capacity. We don't have big national statistics offices. We have small capacity, we have a large demand for data, and we have lots of administrative data gaps. So when we're looking at how do we start to answer some of these problems, we have to do this within our existing capacity of collection. We can't be adding new collections to it. It's about how do we make the best from what we've already got. So as I said, there's a critical need to improve the data, and I think data linkage gives us a really good way forward of doing that. We have to drive the CRVS system improvements, and that means we have to be able to monitor what's happening to them. And to do this, we have to be able to use our existing data collection schedule, which means making use of the administrative data and the survey data that we already have access to. Capture-recapture or the data linkage methods are essential for us because they don't make that assumption of a gold source standard. And I think this is one of the areas where we fall over, is that the census is correct. And in many parts of the world, and I'm sure the US and Canada would tell us that's largely true, we're talking about fairly small percentages overall. We know this is not the case in all of our countries. The census has inherent underlying problems. So while it is still our gold standard, it is not an absolute. And so the ability to use these data linkage methods give us that flexibility of not assuming that one source is correct. And I guess this becomes more and more important as we start to look at that unknown component, the who's missing out. If we're talking about inequity, it's the group that's missing out from all of the collections that are going to be most important to us. So unsurprisingly, our sources available are very much the same as what we've seen elsewhere. Routinely collected data, census data, and survey data. The big program in the Pacific is the DHS, but there also are some hybrid surveys as we're starting to look at better survey methods in the region. Just a comment on the availability of data though, and we've talked about this earlier, so I thought I would mention it. Access to administrative data has historically been one of our bigger challenges. Statistics officers are used to the idea of sharing data and linking data and what you can do with data. Our administrative data tends to come from other departments who are not so familiar with what we want to do with it. And so we often face a bigger challenge in actually accessing that administrative data that we need, particularly through health and even more so through some of our civil registry officers. As an example, when we went into Tonga to do data linkage, despite the fact that we had the ethics approval on board, it had been signed off by all the relevant departments, I actually physically sat in the registry office for weeks matching data in order for the registrar to sit and supervise that. Not because they had an active role in the process, but because they had to see what was being done. And so those steps in getting buy-in are sometimes a bigger challenge in our administrative data sets. Our last session, I think we moved on to some of the really important things that I was hoping to draw out today. We've talked a lot about independence over the course of the day, but it's in the last session that we've really started to pull apart some of these other issues around the catchability, the probability of people being reported into the same sources. And when we look at the Pacific, we don't have perfect conditions for any of this data matching to happen. We don't have independent sources as a general rule. We have censuses and surveys, and we have administrative data. In the past, our census data hasn't been detailed enough to allow us to match it to our administrative data. It's been coded at the household level. It hasn't necessarily gone to the depth where we could match individuals. Our administrative data, where we do have that level of detail, is certainly not independent. It's very rare that those two things could be done separately. We can do this in the Philippines by getting away with using an additional source. In Bohol, we had the church records from the Catholic Church. It's one of the very few places I think you could use this, but with 99.5% Catholicism in that particular region that we were looking at. And the Catholic Church has a very centralised standard way of collecting data. It meant that we could put a third source in and deal with that independence issue. But in most of the cases, and certainly in the Pacific, we just don't have that option. We're talking about dependent data sources. Our sources may not be drawn from the same population, so surveys are generally not drawn from the same whole population as the civil registration. Our administrative data boundaries are generally not the same between departments, let alone between departments and surveys. And this is something that we're focusing on in a great deal of depth, but continues to be a problem. We don't have equal catchability of results. So the likelihood of a particular event being recorded really does vary. The surveys tend to focus very much on children. The civil registry tends to pick up landholders because the real incentive is about who's going to have the inheritance. So we get males and we get adults, or we get school entry for births. But there are big differences in the catchability. And the biggest one is we don't often have sufficient detail to match adequately. I recognise the call that we had just before the tea break about using more variables. The trade-off to that is we actually don't have good quality information in many of those variables. So we've actually had to limit it down as much as we can to variables where we know the data quality is good enough to actually match. So there are trade-offs there. So for obvious reasons, most of the studies in developing countries have dealt with survey data and CRVS at small scale, or they've dealt with matching to the census. For the Pacific, this is not really meaningful for us. We have small population sizes, we have centralised services and a very mobile population. So events are rarely at small scale. We do have to be able to look across larger boundaries because people travel for medical care, people travel to give birth. It's a very mobile population within the country. And I've already talked about the boundaries not aligning. So the Kiribati study we looked at, Kiribati is only about 100,000 people. It's not big. We had records from the Ministry of Health and the Civil Registration Office over 10 years. And we matched these manually. Both of the studies we've done in the Pacific relied on manual matching. And while I'm very anxiously looking forward to how we can integrate the IT in a much better way, the manual matching has been necessary for us because of some of the problems around the data. I'll get back into that in a moment. What we found from that result was that there was an underestimation of the impact of adult mortality particularly, and therefore an overestimation of life expectancy. These don't look so dramatic. As you can see up here, it's very small differences, but the published data was very much done on the reconciled data. So when we put them together, what we found in just putting them together and ignoring that unknown component. One of the things that we really learnt from this is there is a huge level of discomfort with describing that unknown component. It's not accepted readily by policymakers that they might be missing someone out altogether. And it's actually not very well accepted in the academic community. It's like, how do we prove beyond that? So there was a much greater level of comfort around reporting reconciled data results than there was about reporting capture-recapture estimates, which take into account that unknown component. We still seem to have this level of, well, if we can't put more information around, if it's not captured anywhere, then how do we know it's really there? Our data matching was affected by a number of things. The record storage systems were very basic. We don't currently have person-based civil registration, we have event-based civil registration. It's something that we're working on. The record data quality is very poor. We have inconsistency in the formatting of fields. And this is, again, where you start to run into all of those problems with the IT matching and the computer-based matching, because you have to manually go through and actually fix up your data first. So that pre-processing can become to the extent where actually you might as well just match them manually. Frequent estimation of date of birth and age. We've got very poor historical records. And substitution of reporting dates for date of event. There's a lot of inconsistency in how these were actually put down. Kiribati is particularly interesting because of their naming conventions, and I think this highlights one of the biggest challenges that we're going to have using computerized matching. In Kiribati, a person can have basically 4 names, 4 first names. So you have the name that you're given by your parents. You have the name that you're baptized with, which is usually not the same name. You may have an anglicised version of the name that you've been given, which may sound quite different. So, for example, our colleague in Tonga that we do a lot of work with, his name is Sione. In English, his name is John. They sound nothing alike. They don't get picked up unless we actually know they're the same thing. And then, of course, you may have a nickname that has stuck with you for so long it's become almost the officially used name. And that's just the actual names you're given. We then have the spelling variations and the fact that Kiribati is a very phonetic language. So this construction of how names are spelt is generally driven by how they sound, and it can be varying across 5, 6, 7 different variations. Surnames are then based on the first name of your father, so there's already 4 different combinations there. If you happen to live in someone else's household while you're going to school, then you may actually choose to use their name as your surname. So if you go to live with an uncle, most people would then swap their surname for their uncle's first name rather than their father's. So names are flexible depending on your stage of life, where you are, and all of these other factors that go into it. It makes this probabilistic matching very, very complex. What we actually had to do was come up with a series of different combinations that we could use. They had to allow for name not being one of the driving factors, but still appearing within there. And so we tested out quite a number of different combinations on a smaller data set. But again, the issue is that this then can't be tested as a sensitivity test at the end of the process. So we end up with what we have field tested as a very effective match with a smaller group of data where we know the outcomes. But we can't then look at the impact that that's had on the overall data set. And you can see the final variations. We had a number of different combinations which we used as the final match. The second issue, as I said, was that the dependence was a problem. The health and registry data is not independent. The registry requires a medical certificate for death, and therefore there is more likelihood that a death recorded in health would make it into the registry office. The advantage of this, I guess, is that it's more likely to be positive dependence, which therefore is less likely to underestimate, if that makes sense. So it tends to give us a reasonable bottom level. It may not give us an exact, but it gives us a baseline. So while we can't necessarily hang money on our final estimate, we can hang money on a lower level. However, this appeared to be somewhat different for young children, and this is one of the key things that came out when we looked at the results, is that we had this positive dependence at most of the age groups. We knew that from our system assessment. But when we looked at children particularly, first of all, the matching criteria were much, much worse because their names aren't fixed. They haven't been using that single nickname that's become set. They haven't been baptised necessarily, or their parents are testing out 2 or 3 names for them. So there's this huge flexibility in matching. So you have a bigger problem about undermatching in that age group, but we also have what we believe is a difference in dependence. So there isn't this positive dependence because there's not the incentive for these deaths to be registered, whereas there is for older people. So someone older who dies may have property, may have been enrolled or in contact with government services already. A child who dies, as long as there's some record of them somewhere, why would you need the second one? So there's none of this positive dependence, and in fact having one record was less likely to give you the second record because there was nothing in it for the family. And so what it meant was that we got these really wild results for that early age group. And we couldn't use the capture-recapture analysis for that because we couldn't deal with that issue of dependence adequately, where we could in the older ages. So I've mentioned this, the conventional methods around confidence intervals, the calculations, they are just that. They're confidence intervals around your calculations, not around the uncertainty of your matching, around the sensitivity of that. How we deal with that without being able to use computerized matching to do sensitivity analysis, nobody's really got a solid answer for, I don't think. It's something that we've all identified as a problem, but we haven't really been able to solve it. We've come up with ways of testing the validity of our method as a precursor to actually going ahead and doing the matching exercise, but we haven't really got the ability to go back and retrospectively test the impact that it had. And I think this is going to be one of our continuing challenges as we move forward. Record linkage, therefore, can't, at least in our region, give us an absolute answer. It gives us a range of plausible results. And so what we're able to do is basically set a lower limit for what we believe is happening. It gives us the plausibility of the results that we're seeing from other sources rather than giving us a true estimate. And while that may not be good enough in systems where civil registration and sources are already better, in a system which is actually behaving poorly, even having those plausible limits gives us something to work towards. So I can see that this would have very little application in a setting where you're talking about 5% difference, because the uncertainty around this is massive. But where we're talking about systems that are on the 40, 50, 60% mark, then it does give us enough to actually start to make some system adjustments. And this is just an example of one way that we have used this data to set plausible limits. So this was some work that we did with Sione Hifanga in Tonga, where we first of all looked at the mortality envelope and then applied that to the causes of death to look at the changes from two periods, from the earlier period to the later one. And we couldn't get a specific estimate from one period to the next, but what we could do is set plausible ranges around those periods. And so it still gives us the ability from a policy point of view to use that information. So in summary, the three-source analysis, or the ability to deal with truly independent sources such as the census, I still think has a huge amount of advantage over what we've done with administrative sources. The problem is that in the past, the censuses have not been coded to that level. We may ask, are the deaths in the household? Are there deaths in the last 12 months? But then what we have is a household listing of ages and where they were. That's not necessarily detailed enough for us to then go back and match. For us to collect that information, sometimes we actually have it, but it's not coded when we do the data processing. So it may be in the original collection, but it hasn't necessarily made it through to the coded data set. And that's something that we want to look at. But even though there is some significant problems using administrative data for two-source analysis, in some settings, and particularly in lower development settings, I think this does give us something to work with that we haven't had before. This constraint that we have about working within our existing resources. And while I'm looking hopefully at some of the work that's happening about this forward-looking capture and connections, I'm struggling to see a way where this will actually be able to be a plausible solution at an administrative level for a little while yet. It will get there, but we're a little way off that. So in the meantime, using this inadequate but available administrative data, I think gives us a way of setting plausible limits around what we're seeing. And that in itself is useful. There is a huge need to engage closely with policymakers. Firstly, so they understand and accept the results, and secondly, so they'll let you near the data. Access is a huge issue, but as I said, this issue about reconciled data being much more acceptable at a policy level than a capture-recapture estimate is one that we need to deal with. The whole, well, that's a science, it's an estimate, it's a calculation, we should set that aside, we don't trust it. So we need to have them involved. We also very much need to have their support to have local staff engaged, and Chalapati mentioned this morning. Given the complexities of the data matching, this is not going to get easier in the short term. And while we are working on getting better administrative records as our base data, there are going to continue to be complexities around naming and recording of dates and recording of events and how we put those together. And the only way to get those done effectively is to have local knowledge in what will work and what won't in order to check that. The matching and dependence can vary significantly by age, somewhat by sex, but predominantly by age. We need to be aware of that so that, again, I think someone mentioned this earlier this morning. I think it was in one of our discussants' notes. This need to start at the baseline levels and then build that up to a national picture. So making sure our data is disaggregated so we truly understand it. For us, we have a few plans for the Pacific. I don't know how realistic all of them are, but we're working on them. So as I said, one of the things that we're looking at is some records around ex-prisoner mortality. We're also looking at how we might be able to use the 2016 census round, which is currently starting, as giving us an independent source to do capture-recapture work. So we're hopeful that we'll be able to extend this to further assessment of death registration, but also for births. Long term, I think our ability to scale up the use of these methods is really going to be about how can we try and learn from some of the probabilistic computer-based matching to apply that in these populations. I know there's lots of high hopes around the machine learning. I'm not sure that our populations are big enough for the machines to learn enough, but how we can start to make use of that technology, I think, is going to be critical. There's lots of legislation processes to deal with. The data sharing is a big problem. It's something that's high on our agenda. And of course, the basic record keeping. The better we can get the underlying data in the civil registration system, the more likely we are to be able to match it to other sources. Really quite simple. And actually having the standards around how that's reported. And then just finally, in response to a comment that Sam made this morning about linking with ID systems, the Pacific is currently doing a lot of work with electoral registers and updating the electoral register to improve birth registration. And there may be some scope there for us to look at whether we could capture that information somewhat separately in the first place to do some completeness analysis from that. So thank you.
So I want to thank both Karen and Sonia for two excellent presentations. You really touched on several challenging issues, which really highlight the kind of work we have cut out for us in the context of the 2030 Development Agenda, which emphasizes this principle of leave no one behind. And I think both presentations sort of unpacked really interesting issues in terms of minorities and vulnerable populations in high-income countries, but then also even in places like the Pacific Islands where you have highly mobile and diffuse populations and the real challenges for some of our methods. I think we're doing great on time. We have about 40 minutes to have a moderated discussion. I'm going to pass to Tom Herzog and Carla Abuzar to lead us on that. And I think they want to sort of moderate the discussion and guide us to think about kind of the future implications of some of these issues in terms of field research and new methodological advances. Thanks, Carla and Tom.
Sorry, I wanted to say something about some work that I had done, which is sort of a little ways afield. Should I just go do that now?
Please.
Well, I've been living in San Diego for the last 18 months, but before that I lived in very close to here. And I was the chief actuary for the Federal Housing Administration for quite a number of years. And starting in 2005, after reading Bob Schiller's book called Irrational Exuberance, it was clear that there was a housing bubble. And we had a database with a large number of mortgages that HUD insured against the risk of foreclosure. And so we were worried that the risk was that the people who owned the houses couldn't pay off the mortgage. And we realized that we had a lot of mortgages that were basically dead, that they'd been refinanced, but the bank didn't tell us they were refinanced. And so we wanted to reduce our insurance in force by getting the mortgages that had refinanced off our database. And this was a massive problem. And so the good news here was that we could write some very elementary software ourselves and figure out which mortgages had refinanced. If we had a mortgage on the same single-family property address with one mortgage at 12% and the other mortgage at 8%, it was clear that the people had refinanced. And so we were pretty effective with very simple software that we wrote in a couple of days to identify tens if not hundreds of thousands of mortgage records that needed to be deleted. And so we were pretty successful at getting large numbers of these mortgages off the books. And the people in the HUD budget office were catatonic because they figured all the mortgages were going to disappear. And I thought that was a great idea. My hope was to get it to zero for when the housing bubble blew, then we didn't have any risk. But we didn't quite get that far, but we did get a bunch of mortgages off the record. So anyway, that was my story.
Thanks. Mortality of mortgages as opposed to people, but that's super interesting and helpful. Thanks.
Okay, well, I'm sure everybody has a lot of questions to Karen and to Sonia, so I thought rather than put some specific questions, I would think back a little bit over the day and also think a bit about tomorrow. Because tomorrow we're going to start with, we're going to create a collection of papers, for example, out of this meeting. And then also, can we sort of come up perhaps with some suggestions on how to make better use of data linkage projects for countries that are really, and we're thinking specifically of those who are struggling to strengthen their CRVS systems. So I kind of have some general sort of conclusions that have emerged from listening to the debates and the discussions this morning and this afternoon. And so one general conclusion is that all data sets are imperfect. I mean, it's sort of wonderful to listen to the US and to Canada and to say all the struggles that they're going through with these, somebody who works like me on sort of more low-income countries, it looks like luxurious, fabulous data sets, full of all this information. And yet you're worrying away on these data sets to make them more perfect. So, but I think that's a really important lesson because we will not attain perfection. And we must acknowledge that. So let's not set the bar so high that we can never jump over. It's just a continuous improvement process. And I think that's important. And maybe can help sometimes the policymakers, because policymakers don't like being told that there is no perfect data set. They've put their faith in the census, or they've put their faith in civil registers, or God help us, they've put their faith in hospital records, and they think they get very upset. So when we tell them they're not perfect. So I think that's a general lesson that we need to be much better at communicating to our policymakers. But coming back from the policymakers to those who are sort of producing the data, I think some things that came up that are worth sort of repeating before we go into a bigger discussion. And one is the ground level up, and I think several people have mentioned it, the importance of the integrity of that basic record at the moment it starts. And the moment it starts is at the point of notification, actually. If we look at many systems, civil registration systems, notification is a very haphazard process. Some guy writes something on a little bit of paper, nobody ever stores it, nobody's validated, off they go along somewhere. And then that becomes the basis of a registration record. And, if there are errors there are going to be errors in the registration. Once there are errors in the registration, of course, in the certification, and of course in the statistics. So starting at that very, very basic level, I think is a lesson we need to take home. I think a second lesson is that IT, it's a wonderful thing, but it's not necessarily the solution, which is a bit disappointing, really, because I think we've all thought it's going to get easier to do record linkage because we have IT systems. Now I'm not entirely convinced, and I think especially after Karen's presentation. So I think that we have to handle with care in a way, and that maybe we shouldn't just think that, I think that having the clerical review of data sets can also be important, and somehow we need to link those two. But IT isn't a replacement for that. It's maybe something complementary to it. I think another issue that bothered me a bit was this whole issue of independence. And I think it came up particularly with regard to HDSS and sort of data linkage between CRVS and HDSS systems. And I think the issue is going to get even more complicated, because one of the strategies that's being recommended to countries, in fact, is it's not simply to use the HDSS to sort of validate or verify or check the CRVS system, but is actually telling countries, you should use your HDSS system to increase registration. So all those people who are doing active surveillance of events are now being sort of advised, and you should work with the family to go and register the event. We're not going to have any independence anymore between the HDSS and the CRVS systems. So I think, you know, it's probably, the search for the end of the rainbow, looking for a truly independent system to do the record linkage. So we've got to keep that in mind. The other thing I wanted to come back to was the ID systems issue. I still think it's a potentially important solution, maybe. But the problem is the way ID systems are currently being implemented. And I can't remember, it was Maria Isabel, I think, who said earlier on this morning that these ID systems are coming in from a different direction. And they have nothing to do with data, generally. They're not about data. They're about security or electoral registers or business processes or airline travel or whatever. They're certainly not about data. And for most of them, in most countries, start in early adulthood. You know, when you're 16, you get your ID number. But all of that sort of existence before 16 is ignored by these systems. And then we've seen, Sonia showed very, very clearly, we've seen that it's actually often the young children who are missing from our systems. And so if we rely on ID systems, that'll increase even more so. So I think we have a job to do to work out how to make the ICT systems help CRVS, and we're not there yet, we haven't done it. And then the last point I think I wanted to say was about, what was it about? Oh, yeah, the issue of confidentiality and data sharing. You know, sometimes I think the issue of confidentiality is something that people hide behind. It becomes a bit of a fig leaf. It will protect me from having anybody interfere with my data set and saying it's not perfect. But it is a real issue also, so we can't just ignore it. And I think the only way to deal with these issues is actually much more open debate. I don't think we have that in countries yet. My daughter once said to me, she said, I don't understand why you have all this fuss about CRVS and birth and death registration. After all, everything's up on Twitter and it's on Facebook, you know, and there's no confidentiality there. And yet people make a big thing about confidentiality when it comes to official data. So I think we have a need for a much more sort of open discourse about that. All of this to say is that my conclusion from this morning is that it's not going to be easy. And that it wasn't the conclusion I hoped we would reach, because I was hoping that at the end of these 2 days we would have like a little sort of menu or a roadmap that would say, you know, if you're a country in this situation where you've got coverage this low, here's some nice sort of relatively straightforward data linkage that you could do that would help you to get a better grasp on who's missing from the system, you know, how weak it is. And then if you're, you know, you're the USA and you've got, you know, lots of data and masses of hundreds and thousands of administrative data sources to check, here's another much more sophisticated way of doing it. Because I think that's what we need. I mean, I'm still wondering what the recommendation would be to countries. Because if it's too complicated, they can't do it. And if it's too simple, we'll all say, oh, yes, but you know, you didn't take account of all of these issues. So, but it would be good to have some advice, some guidance that we could give that would be practical. Doesn't require, you know, the involvement of many academic institutions, something that you can actually recommend that countries could do to use data linkage to help improve their systems. So I'm still hopeful that we could do that maybe tomorrow. So those are just my thoughts in general, but I think now we should have a discussion in particular on these 2 papers.
That's wonderful. If you think too complicated and too simple, there may be something that we can do. And of course, depending on where we are.
Absolutely.
If we're in the States, we can do more. When we're in the South Pacific, we can enjoy the sunshine. I worked in Vanuatu. Yeah, well, you can, but that doesn't count.
are you chairing, or?
I'm happy for you to, I've handed the chairpersonship
Oh, I
to
see.
you.
Okay, so do we have comments and suggestions? Yeah.
Questions, so that will be
More questions.
yeah. So it's going to be my last barrage of questions, and then this is mostly for Karen, and some questions and some observations, and I think she said it well, that there is no silver bullet basically. So all these solutions have their limitations. I would also like to make this analogy with traditional surveys, where to deal with non-response, we use models, and we know there are other limitations, but we acknowledge them and we're explicit about them, and I think the same is going to happen with record linkage. I would also like to say that in probabilistic linkage, there is this first step, or second step, which is vastly important, which is blocking, because you cannot look at every possible pairs, so you're going to look at a subset of them. And to this day, I'm not satisfied with the existing methodology to evaluate the quality of these steps, because I can really skew whatever you obtain afterwards. Now, in the very good book by Tom Herzog and Shuren and Winkler, they had a brief description of using capture-recapture methodology to try to get an estimate of that. The only issue with when you're linking social data, you have so few variables, like what? Names, birth dates, 4 or 5. And for your different blocking passes, you end up reusing them, so independence is out of the window. Okay? So for me, that's a huge issue. And if you're talking about linking files with millions of records, it's a very, very, very difficult issue, because it means for every linking pass, you need to be able to go and identify all the matches which you missed in the other passes. So for me, and that resonates with the fact that there's no silver bullet. So look, we're talking about using linkage in capture-recapture estimation, to help us. But linkage, to some extent, needs also capture-recapture. So it's a little bit of a chicken and a egg problem. Okay? So I think that's, for me, that really nails it. It's not an easy solution. It's not an easy problem. Okay? And then I have 6 more questions now. Sorry.
Sorry, I might use chair's privilege here, because I took the chairperson back for 10 seconds. Because I'm sure you have 6 other really, really interesting questions to raise. But I think, given that we have like a good chunk of time here, I'd like to see whether we could go through systematically with several issues. So instead of going through all of your 6 in detail, could you just highlight them in like one sentence each?
Okay.
And then we could start collecting a set of topics and then organize a very systematic discussion.
Oh, I
Thank
totally
you.
agree. So I'll try to be brief. It's the hardest thing for me to do. So first of
One
all,
sentence each.
yeah, first is about names, ethnic names. In Canada, we have this issue with Aboriginal. We have some issue there in terms of linkage. Second question I have is about community engagement.
But we're starting with 1 at a time.
Oh, okay. So that was the first.
Discuss names
No,
first?
I think we wanted him to put 6 on the table.
Sure.
Oh, okay.
Let's comprise an
Exactly.
agenda.
Okay.
We're not trying to cover them all, so.
Yes, exactly. Yes. So, so the second is community engagement, and this issue of, dead children who are not registered, and because there's no incentive. I was wondering if there's been some, because again I'm new to this, if there's been some effort to engage the community, because I think that's really important. What kind of incentive are provided at the community level? The next is, I like this idea of record linkage providing a range of plausible values, and I'd like to draw the analogy with statistical matching, which is a very closely related technology, methodology. What you're trying to do with that match is to find similar people, and there are issues of identification there. So where you're also trying to look for, you don't have a confidence interval, you have an uncertainty interval. So it kind of resonates with that. I talked about blocking. Oh, okay. Geography, the issue of boundaries. How about using cell phones data? I'm curious, has anyone looked at that? And that is it. Okay.
Fantastic.
Okay. Yes, it's less than that, yes. Okay.
Okay, does anybody, let's have some responses then for
Or any
these suggestions,
additional
or any
items.
additional
I can
items.
add
Okay.
to those topics, I think. Sorry. Right. So this is all for Karen as well. So yeah, sorry. They're really quick. They're very small things. So you did mention names, and we have an issue in the Tanzanian HDSS where they only collect 2 names. But we know that people have not only the names that are known at their house, which the HDSS will pick up, but also they use different names in the clinics very often, especially for HIV services. So we allow only right now in the software up to 3 names for the individual, and it does a multiple comparison. The first name that we collect looks for a match in both the first and the second names, because it also, yeah. So there are methods that you could use, like, to do that. I use the Jarrah Winkler string comparator, but you said names sort of have a phonetic, So the Soundex string comparator, and there are many more that would be more applicable to your setting. And I, in fact, am going to try to run a Soundex or some other string comparators to see if that changes the.
The Soundex is specific to countries. I mean, German way of pronunciation is very different from the English way.
But in her setting alone, exactly, right?
In
Yeah.
one setting, yeah.
It just in one setting, yeah, not a multi-country comparison. The cell phone data, I think, is really important because in the software, we're currently collecting it, but it's not being used because it's not in the HDSS data. But the last round just started collecting cell phone identifiers. So we're going to have that maybe as a deterministic approach as well. And I don't, just one last quick thing about blocking. You had smaller populations. So I don't, I think coming from Canada where you have to do blocking, I don't do any blocking in my record linkage, and I don't think for such small populations. Ours is 37,000 residents, but it's a file of 108,000 for each different residency episode. So I don't know if blocking would be too entirely important.
Can I speak to that? Okay, so the typical justification for blocking is operational, right? You cannot look at every pair. But I can give you 2 other reasons, 2 other important considerations for blocking. The first is when you use EM algorithm, typically the matches are it's like almost a needle in a haystack. So there's been some debate about what's the proportion of matches for the EM algorithm to converge. So if you have like 1%, or the numbers that goes around is 5%, but there's no solid data to say that below 5% you don't converge. Right, but many studies are kind of recommending that. So if you don't block, you end up with very, very, very small proportion, and the EM will give you garbage. Okay, so that's the first issue. The second issue is we've discussed the use of blocking for operational reasons, but blocking has an impact on your estimation. It has to be factored in. There's some work on that, and actually, when I presented this morning, I flipped through very quickly through this aspect of conditional independent blocks, and this is the idea that depending on how you build your blocks, it can facilitate the estimate of your linkage parameters. So the construction of good blocking strategy is vastly important for the linkage. And today, people are focused on the operational aspect without paying attention to the impact on estimation and how it can help the estimation. So that's another thing we can discuss. So even if you don't have a big file, you may be interested in applying blocking for any number of reasons. So.
Hi. It's a question I have that I think relates to several things I heard today, and it's a question I've wrestled with a lot in my career, I guess, is we all recognize that the data is perfect, and we've talked about all the problems we have with data, and the question I've often wrestled with is when is the data good enough to release? What are the criteria we should be using to make that judgment? And I guess a further part of that is whether it's possible to set up a set of clear parameters or whether it requires some real judgment on the part of social scientists or whoever's dealing with the data.
So just 2 comments. One is, I think, we already have indeed a lot of methodology available. So how to really maximize the utilization of these existing valid methods, I think that's a question. Indeed, just to use one example, in both Mario and Lomichel's presentation this morning, they mentioned, some questions have been asked for birth and death registration in census and household surveys. But I did it like in 2014 for a meeting. I had looked into the death registration questions, and as Lomish mentioned, those questions are not so well developed, like the certification and can be regarded as death certification can be regarded as just a death registration, and also not so many census or household surveys include these questions, as a way we can indeed to kind of do the evaluation for some registration data, but especially for death registration, we haven't really included in household surveys or census in this area. Maybe we can have some standards to say, okay, for those countries with some death registration completeness over 50%, including these questions will be very useful, to help people understand and maybe also adjust the death registration data. So I think really there is some opportunity to use the existing methodology in this area, and really to like especially for in many low and middle income countries, I think the data is there, but we haven't really fully used them. And the second is, regarding the new opportunities, I think in the data revolution period, was really thinking, I think, Abel, you already mentioned some use of the big data in Canada. So just wondering how much we can use the social media data and satellite data in this area. Is there any new opportunities, to include a data scientist in this area? I know there are some researchers using social media data for migration and international migration. It's very successful. So like migration is always challenge for population registration. So whether there's something we can really think of using the big data and the data revolution, including data scientists in these areas.
I wanted to make a point, but Sonia developing a point. Sonia talked about merging everything together and then using the result. And I wanted to say that in the act of merging the data together, there's a lot of information about the internal structure of the data sets, and I'll say capture-recapture possibilities available in that process. And I don't have any problem with merging them all together, but I want to do a little more. And I think that if you look at where the knowledge can be added, in the process, that's one. There's a lot of other areas. That's one area that, because you already have the information, you just didn't use all of it in the process, and I would do more of that. That's what we did in order to deal with the fact that with only two systems, the independence assumption is way too strong, and three systems, it's probably too strong too, and it really is a hard problem, and with multiple systems, different systems in different parts of the population, you may be able to do something. And the thing that I'm saying here is some of it's been done, but some of it needs to be redone. And what happens is, as you all know, a lot of people here have hands-on knowledge, is when you get your hands on the data and you see the issue itself, if you have enough resources and patience, and a good night's sleep and not too much drinking, you can get something done. And of course, if you do it, if you just start at the beginning is do a lot of drinking. It's only at the end that you wouldn't do drinking.
Couldn't agree more. But actually, what I particularly wanted to comment on is that it's that trade-off of resources. And I think there is definitely some things that have come out of the meeting today which would have applicability in helping us look at computerizing the probabilistic linkage for poor data sets, such as we've seen in the Pacific, I don't think it's necessarily quite as neat as it perhaps sounds. I think there's a lot in there. But I think it's something that can be done. It becomes that trade-off of how big is your data set versus how much money is going to be required to actually set up the probabilistic linkage, and actually is it a fraction of the cost to just sit down with a couple of people and match the data? In which case, is that what you do? Because then you build in that local knowledge. Of course, you lose the ability to do the sensitivity analysis. So I think this issue of how do we resource, we can do all of this in pretty much any data set if we put enough resourcing and time and perhaps alcohol behind it. But the question is, where does that trade-off lie for each data set?
Knows people like me who've been around a while. Sorry, I look it now. We don't actually have a lot of stories, history, that for what the people do this work, have been doing this work for decades, over 50 years, even longer. And where are the stories about the local knowledge? Where are the stories written down? Okay? We have some software, but that's not enough. What we need is the stories and the special things we couldn't actually tell you how to do it. We just learned how to do it, and there it is, it got done. And I have many of those myself, but I haven't written them down. But all of you have them. Where is the writing them down? We need to be doing that.
We did case studies in our book.
The case studies are at a certain level of documentation, but I'm going deeper than that because we didn't focus on the linkage itself in the case studies at the depth that I think we need to.
Just to Fritz's point, I think that's a great idea about doing, with the composite that we put together, I think there is a lot of opportunity there. And James is also going to be looking at like the LEHD, the UI wage data, and matching it to IRS data. I think some of the complexities involved in looking at some of the composite is that, for instance, some of the files, like the Indian Health Service data, really covers American Indians very well compared to the other data sets, but then the coverage relative to the other data sets varies. Similarly, like the Medicare data, great for 65 plus, or we have the rental assistance data, but to the extent that they overlap really well, that's sort of why we put them together in the composite, so that we could try to replicate the United States population as much as possible. But I think we are trying to do that to a certain extent with trying to get out other sources like the UI wage data.
I'm game.
Perfect.
I know a lot about those systems.
Yeah.
Just haven't done that.
So I'd like to come back to this point of Fritz's, where are the stories? And we often sort of say to ourselves, we remember the good old days of the IIVRS, the International Institute for Vital Registration Statistics. Sam, of course, was involved in this from the beginning. Well, what was great about that is that it did bring together stories and experiences, and these papers were put out. They stood the test of time. If you go and read them, they're still very interesting. But we don't have that mechanism anymore. So one of the things we were thinking that perhaps this series of papers could be is kind of beginning to say, here are some experiences, and they're valuable experiences, even if they're from highly developed countries. I think there's some commonalities that come across. The excluded groups and how difficult it is to locate them, and different methods for doing so. So I think if we could look at this series of papers as starting some of those discussions and experiences would be good. I'm looking to our friends, from Egypt and Palestine and Philippines, because we haven't heard a lot from you, and we're going to ask you to share your thoughts with us tomorrow. And it would be, or even today. And it would be really interesting to hear from you, having heard all this, is this relevant? How would you use some of the techniques you've heard about in your own settings? Because you have systems that are relatively good, performing on the whole quite well, and yet, I'm sure you know better than anybody that has their weaknesses. So do you see the potential of some of these data, capture, recapture, or direct methods to to improve, to be a better diagnostic of the weaknesses in your system and help you improve them. You don't have to answer, but we will be expecting you to answer tomorrow. Okay. Fritz.
No, I don't have to say, I don't want to say anything.
No.
What you said is just wonderful. That's right, that's right. There's just so much more we need to do.
Yes.
And we need
Yeah.
to use the recording which exists for this meeting and develop it a little bit more. I will say this. I've lived a long time. I made a lot of mistakes. It's time to talk about those mistakes so other people don't make them.
What we've heard today? Yes, Karen?
I don't have a lot to add, but I feel like since some of the comments were directed at me, I should probably say something. Just running through I think the big one is very much, I've talked about it in terms of that trade-off between the data set size that we're talking about and the level of resources, the intensity which we're prepared to invest in it to get the result that we want. I just quickly wanted to talk about the naming issue because it's obviously one that affects everywhere we work to varying extents and varying levels of horror when we look at the data. In Tonga, when we put the data together, we actually included a criteria that allowed us to match without any name matching. So we had, again, a series of different conditions that could be met. In neither of the studies did we manage to get down to one set of criteria. There was always a grouping of you can have this, this, or this. And in places like Tonga, we found that we actually had to include the possibility of not having a name match, but having enough other identifiable information that we were reasonably confident that that was the right person. So I don't think there is a simple answer to that. I think this is where whether we go down the path of the probabilistic, the IT methods, whatever else, this is where we do have to sit down with that local knowledge and work out what is the flexibility around naming, what are the sound constructs that go with different letters. I've worked in Kiribati for a number of years now and I still can't pronounce most of the sounds, let alone recognise what letters they particularly go with. I'm pretty good at causes of death in Kiribati though. But this is not going to be an easy fix around that, but I think it's about developing flexible approaches where we can have either or and finding that way of testing the sensitivity in a more structured way. I think that's what we've really been missing. I was asked about the community engagement, the incentive for registering deaths of children. Primarily this has been addressed through partners such as UNICEF because there is no tangible incentive to registering the death of a child. There's not going to be, except in a very small handful of cases. Places like Nauru actually provide a funeral assistance payment. And we get the alternative problem there where we get all stillbirths registered as well because they want the assistance. But we've tried to deal with this primarily through UNICEF and through other community-based partners talking about the advantages to community of understanding what's happening to their children, the protection of children, you get better policy, better healthcare, better responses if we understand what's happening at your community level. So it's really about tying those incentives back up a level rather than at the individual family. And I think in terms of the phone data, I don't think the Pacific is there yet, although it's definitely coming. We've got lots of issues around, I think I mentioned this to Ramesh in one of the breaks, lots of issues around data being linked to things like mobile phone records where perhaps there's no policy and protection around those and the ability to track people. And I think we've probably got some work to do around the protection of data before we could move into that area. But I'm wondering if in countries outside our region, more in Africa and Asia, where they're starting to look at mobile phone registration of events, whether there's more possibility around that. And that's all I've got.
Yeah, I think mobile phone registration of events is a problem because very few people accept a mobile phone as a legal sort of informant function. It's so prone to abuse potentially. So I think it's a problem. I wanted to ask, in South Africa, I noticed that on the name issue, you only matched on surname. And were you able to do that because of having a national ID? I mean, I say most of the people in the site, I think, had an ID. Is that why you were able to do it? Because I was quite surprised, because a lot of people have the same name, the same surname. So.
Okay. Name is captured on our death notification forms. However, Status A doesn't give it out. So for that reason, we couldn't use name, but surname was a variable that we could get hold of. However, yes, there are, maybe not to the extent that Karen has said, but there definitely are names issues. Someone would have, for example, an English name, and then the local language name will not be mentioned, and someone can be known only by his English name, but then the other name is not known in an area. Or back, say, in the area of Asian court, they may know the baptized name of the person, but wouldn't know the English name. Surnames we had, and sorry, Carla, what was your other question?
That was it, really. That
Okay.
was how you were able to match only using surnames. So you do have names issues.
We do have them on the death certificate, and that was one of Pam's in the presentation. There's the plea that we do have them included, and we have spoken to Stats SA about it too. And if they are happy with the confidentiality of the protection of the confidentiality of the data, I'm sure it's something that we can work on and get it.
Yes, our experience in Senegal using names. So I confirm, like Chris says, that you need to collect 1, 2, 3, 4 kind of first names. And in one particular subgroup, we had a very nice habit. It's to name a child according to the rank in the ship, but of the same sex. So the first child, male, born to a woman, he has always the same name, Charo. The second, Tama. So, but if she is a girl, so the first girl of a woman, she is Nyano, etc. It's the name that is given in a census. So you have nearly half of the women who are named Nyano, and the family names are only a few. So you have nearly 10% of the female who are Nyano Keita. So if you use, and it's what is in the census, you'll get a lot of problems. A lot of. So of course, in the HDSS and other sources, we ask other names. Of course, there are other names, and also we use the names of the father, the names of the mother. In some cases, to match individuals, we use for a woman the name of her spouse, and often also we use the names of her children. So a woman would be said the mother of this person. So it's when you are conducting this HDSS and follow-up survey, you try to capture all these different names. If you just rely on the first names that the person gives, like in the census, you couldn't do anything. So it's a big work, and but afterwards you can make record linkage.
I think what we are losing focus on is the aspect of strengthening the civil registration system. I think that is the primary goal, and evaluation of the completeness is a step towards strengthening the civil registration system. Taking on from where you were speaking about the importance of accurate recording of the name, or the recording of multiple, or what we could say complete names, is something that we should focus on in the regular civil registration system, because that's when we can start having records that are amenable to matching exercises. Along with that, we need the accurate recording of the dates of death, the age, verifying the age from the notificant or the informant, asking for multiple sources. At civil registration, do what could be through getting notifications from multiple sources to make sure that as many deaths that occurred within the community are actually captured in the registration system. You may not be successful in getting all, but you should try. So all your multiple sources should be sort of pooled together at the time of civil registration. Then we need to assess completeness. The ideal independent source for assessing completeness, in my experience, is the independent household survey. No matter what our experience has been of surveys being of indifferent or poor quality or difficult to mount, costly, etc., the independent household survey is the one, at least in qualitative terms, independent. It's directly asking the household who's reporting the event. It's not collecting information from other different sources where dependence might creep in. It's the direct report from the familial respondent. Each country has, even in the least developed countries, has a regular survey program of some sort or the other. So the independent survey program should be strengthened, not through asking questions about has this death been registered or not, but through the recording of all details of the death that had occurred during the reference period, so that it can provide input for the matching exercise. Just asking whether the death was registered and trying to evaluate an estimate of completeness is inadequate. So you have the DHS, you have the mix, you have the socioeconomic surveys, you have umpteen surveys in which a question about a death within a certain reference period and collecting the name, age, sex, etc., and the address accurately, and there again the multiple names, the complete name, the exact age, etc., will provide you with the best possible evidence with which you could then go and do your matching exercise. Then if you want to do it using computers or tablets or pen and paper or whatever you want to do, at least you've got the data to be able to do it. Thanks.
So you're suggesting kind of ex ante process rather than ex post facto, which is what we do with data linkage. But the problem with the surveys, the DHS, for example, or mix, is the respondent base is quite narrow. It's women of reproductive age, or maybe people of reproductive age. So I think there'll always be problems about relying on that as an independent source.
We're asking about the death in the household. So it's not about, only about their siblings or anybody else or their children, any death in the household. I'm just using it as survey as a DHS as a platform. If you have, an intercensal survey, or you have a post-enumeration survey, or any other, socioeconomic surveys, they are also viable platforms.
Okay, well, it is approaching the hour that we had said we would conclude. I think we have still a lot to think about and ruminate over, so it would be good for those of you who are joining us for dinner to ruminate over a drink, and for those of you who are not, we want a photo? Okay, we'll do a family photo. Okay, so just one more last check. Who's coming for dinner? Just raise your hands. Okay, so I think we're on 10 again.
Okay, so hang on, because we have a booking for 12. That's the largest they can give us. So I just want to make sure. I think you may be 13 or 14, actually.
Oh,
But
okay.
we'll try to figure that
All
out.
right, we'll figure that out.
Okay.
Okay, so we are going to do the group photo, I think, for the records and the anecdotes. This will be important because this is the start of something new. And then we will, those of you who would like to take a cab are very welcome to take a cab. We'll give you the address, but if not, the rest of us are going to walk.
And a quick housekeeping issue, for those of you who've been funded by the IUSSP and PAA with your travel, I think I think France will need boarding, like actual hard copies of your boarding pass to the United States. So if you could give that to France before the end of tomorrow, that will help for record keeping purposes. Thank you. We're going to start sharp tomorrow at 8:30. So, given that we all have to navigate the
Security.
security, please factor that in. Thanks.